Good morning, good afternoon, good evening, wherever you are. Thank you so much for coming on to another intensivecarehotline.com live stream. Ask me anything, which means you can ask me anything that is related to your loved one in intensive care. I presume you have a loved one in intensive care if you are coming on to this show. Just very quickly, before we dive into today's questions, my name is Patrik Hutzel, founder of intensivecarehotline.com, also founder of intensivecarehome.com. Just quickly, what makes me qualified to answer questions for families in intensive care? I am a critical care nurse by background. I have worked in critical care for over 20 years, nearly 25 years now in 3 different countries, where I also worked as a nurse unit manager for over 5 years. I have been consulting and advocating for families in intensive care for over 10 years worldwide as part of my intensivecarehotline.com consulting and advocacy service. We also running a community nursing service, intensivecarehome.com, where we provide a genuine alternative to a long-term stay in intensive care for long-term intensive care patients, predominantly with ventilation and tracheostomy. We are running this service currently all around Australia, predominantly on the East Coast, Sydney, Melbourne, Brisbane, but also all around the country in all regional and remote areas as well. Intensive care hotline, obviously, we consult online, we consult over the phone. It's an international service. Without further ado, if you have questions, either type them into the chat pad. Alternatively, you can come on the show here by using the link that I'm just posting into the chat pad here. So if you want to come on live to the show, you can just click on the link and I can get you here on the call with me. You don't need to go on camera, and you can just, stay without a camera. You can just talk to me. But anyway, Christopher, who's one of our members, thank you so much, Christopher, for coming onto the call. Christopher asks, I just wanted to say thank you for your guidance. Upon your advice, I stood my ground and doctor agreed to home healthcare. That's fantastic, Christopher. I'm so glad to hear that you've had a good outcome for your mum. That is fantastic. Thank you so much. And I will pass on your kind words to the team as well. And you said no to sniff after I visited one. Hospital staff tried to pressure me into hospice care, even though my mom has been improving. Unbelievable. Yeah, Christopher, it's very sad what's happening in hospitals in 2023 and even before COVID. Unfortunately, unless you are faced with a challenge like you were and many others are, people trust the system, and they believe that the system will look after them. Well, unfortunately, that is not the case. Unfortunately, you need to seek outside guidance, which is what you've done, Christopher, with good outcomes. It's why would a hospital offer hospice if someone is improving? It's unbelievable. It is absolutely unbelievable. I can give you another example from this week. We are working with a client currently who has their 54-year-old mother in ICU. This lady is 54, has been in ICU only for a week. And basically, the ICU team is trying to coerce her to agree to hospice for her mum. And palliative care literally told her, if you want your mum dead today, we can do that now. Can you imagine? Can you believe that they have the audacity to say things like that? That is extremely insensitive. Look, I'm a very straight shooter. I'm not always sensitive to the point that I need to be, but having worked in ICU, it certainly made me very sensitive to, what families really think and how intensive care teams should conduct themselves with families in intensive care. And, by saying things like, well, if you want your mum dead today, we can organize it now. I mean, that is just unbelievable. It's unheard of. It's so inappropriate. And it makes you wonder, are hospitals really killing machines? Is it a factory now where we where we just want to kill people? Is that are they openly admitting, oh, we are euthanizing people if need be, and we can do it today? It's unbelievable. It's unheard of. We obviously educated the client on their rights and, how to stand their ground and all the rest of it. But it's unbelievable what's happening in this day and age. And big shout out here also on that note to Scott Scara in Wisconsin, who has taken the death of his 19-year-old daughter from 2021 to the court and is trying to sue the hospital. And it looks like, the court is now moving his case to the next step, to another hearing, which is great because most courts are just rejecting, the claims. He claims his daughter was murdered in October 2021 in a hospital in Wisconsin. And, hopefully Scott and his family, as well as the team that he's working with, can get justice for his daughter, and the people responsible for his daughter's death are being brought to justice. Check out, type into Google Scott Scara. His daughter was Grace Scara. I had him on an interview here a few weeks ago. You can also find it on my YouTube channel or on our website, intensivecarehotline.com. Ron has a question and says, what impact on patients and families has medical aid in dying had in countries where you have practiced? What impact on patients and families has medical aid in dying had in countries where you have practiced? Yeah, sure. So, having worked in ICU for over 20 years in 3 different countries, what I found in the end, and this is, me probably being blind for it for a long time as well, I found in the end that, strictly speaking, I do believe that euthanasia is common in ICU, and I've been part of it, not knowingly at the time, but the more that I've practiced and the more that I realized also practice was changing and more people were moved towards end-of-life care faster than before, right? That I believe that euthanasia is common in ICU, but just nobody uses the word euthanasia because euthanasia is illegal, and people might cast stones at me by me just saying that, So, for example, to give you an example here, Ron, so let's just say someone is taken off a ventilator, right, and the breathing tube for end-of-life care, right, and there's absolutely no guarantee that people will die just because they're being taken off a ventilator. There's no guarantee for that. I have seen that you take people off a ventilator for end-of-life care and they might live hours, days, weeks. Okay, the question here is, what's the quality of life like, and do you want to hasten death in a situation like that to supposedly, quote unquote, end suffering, right? And then you can give medications such as morphine, midazolam, to speed up the process of dying, to hasten death, so to speak. And if you look at the definition of euthanasia, it is to hasten death. So morphine and midazolam is something that is being used in palliative care all the time, and it does hasten death because it inhibits respiratory efforts, right? So I hope that's the medical aid I am talking about, and hopefully is what you're asking for, Ron, that the medical aid that I have seen being used to, in dying is really morphine and midazolam, and sometimes glycopyrrolate as well. But, the process really is being aided with morphine and midazolam. Morphine being a strong opiate and midazolam being a strong sedative, also known as a benzodiazepine. I hope that answers your question, Ron. I do believe it has become more prevalent in recent years. COVID has highlighted that, but it was definitely there before COVID. It's when you look at back 10 years ago at my earlier blog posts, I was talking about it there and then. It's nothing that just came up with COVID. It was there before COVID just highlighted the issue, that more and more patients are potentially being euthanized, So I hope that answers your question, Ron. Now, Christopher, you're also saying my mom has a long road to recovery ahead of her, but we won't give up. Thanks again. Yeah, sure. I am never saying here that what we offer with consulting and advocacy is a quick fix. Never said that. You know, if anything, I always say you are in for a long run. You know, if you want recovery for your family member, you know, you got to be patient, and you know, you got to put the work in. So I never say that we have a quick fix. Never. You know, unfortunately, recovery after critical illness is a marathon. It's not a sprint. It's a process. It's not an event. You know, but yeah, not giving up is what's needed. You know, and even if you're not giving up, and even with your best intentions, there are no guarantees as well. You know, there are absolutely no guarantees. But what we are finding is that, you know, most families that work with us, even if they say, hey, look, you've helped me to extend my mom's life, my dad's life, whatever, my spouse's life for another 3 months, it was worth doing it. You know, longevity is a whole nother thing. You know, we're not talking so much about longevity here. It's about, what do you want for your family member? Do you want to give it a good shot, or do you want to just give up and throw in the towel? What most families want to know is, have I given it my best? Have they given it their best? Right? So, you know, that's what it really comes down to. It comes down to making informed decisions, having peace of mind, control, power, and influence. Most families in intensive care can accept that their loved ones are dying, right? We're all going to die one day, and you know, we can accept that. The question is how, and you know, are we having a say over it? Are we in control of it? Do our families think they are in control of it? Right? That's what it comes down to. It's about the aspect of not feeling belittled, and not feeling, well, I make decisions for you, how you go and when you go and what that looks like. You know, it's that one size fits all approach that hospitals seem to have nowadays. Okay, Cat Dry says, I believe Karen and Quinlan lived 9 years after being taken off the ventilator. Look, Cat Dry, I thank you for your comment. I have no idea who Karen and Quinlan is. I might do a very quick Google search, but I have no idea who Karen and Quinlan is. Just give me a second. Now, I can tell you there's plenty of people living after they've been taken off the ventilator. Most people, as a matter of fact, do live when they are taken off a ventilator. Karen Ann Quinlan was an American woman who became an important figure in the history of right-wing controversies. I have no idea who she is. I'm not even sure whether I'm Googling the right person here. Crashed out and lapsed into a coma, followed by a persistent vegetative state. Okay, I can see. Yep, I can see. I need to do some research there. Okay, thank you, Cat Dry, for making me aware of Karen Ann Quinlan. I can just see her Wikipedia page where it says life after the court decision, death and legacy. Okay. After her parents disconnected her ventilator in May 1976, following the successful appeal, Quinlan's parents continued to allow Quinlan to be fed with a feeding tube. Since that didn't cause Quinlan pain, her parents didn't consider it extraordinary means. Quinlan continued in a persistent vegetative state for slightly more than 9 years, until her death from respiratory failure as a result of complications from pneumonia on June the 11th in 1985, Morris Plains, New Jersey. Upon learning that Quinlan was expected to die, her parents requested that no extraordinary means be used to revive her. Quinlan weighed 29 kilos at the time of her death. Quinlan was buried at the Gate of Heaven Cemetery in East Hanover, New Jersey. Okay, thank you so much, Cat Dry, for making me aware of Karen Ann Quinlan. I had no idea who she was. Thank you. Yeah, it was years ago in 1976, a huge legal fight in the US. Yeah, absolutely. So, you know, yes, she was living in a persistent vegetative state, you know, and I'm not the judge here whether that's right or wrong, but obviously that's what her parents believed in. They wanted their daughter around, you know, and that was their choice. Okay, so now I also want to make a quick comment here that next week I am going to dedicate a YouTube live to Gregory. I don't want to go into too much detail now, but I do believe Indy deserves a mention here. If you type into Google Indy Gregory, you will find that the UK courts have done it again. The UK courts have allowed the NHS to kill another innocent baby in ICU. And I will dedicate my next YouTube live next week to Indy Gregory. I have dedicated other YouTube live shows here to other children that have been killed by the UK court system. When I say children having been killed in ICU by the UK court system, I will dedicate a show to that next week. Unfortunately, it's not my first show dedicating to a child that was killed in ICU by the UK courts or allowed to be killed by the UK courts. Having been denied, similar to Alfie Evans and Charlie Gard and others, to be flown out to Italy for other treatment options. She is another child in the long line now of UK children that the UK courts allow the NHS to kill instead of letting them go overseas for further treatment. It is unbelievable, and it deserves a show here to highlight the issue. It is highly inappropriate, and it needs to be condemned on all levels. But I will have more to say about that next week around the same time. In the meantime, you can type into Google Indy Gregory. Okay, let's get on with questions that have come in this week. In the meantime, please also type in your questions here, or you can use the link here to come on live on the show. If you want to talk to me directly here, you can use the link that I'm just posting in here. In the meantime, let me get to some questions that have come in this week. Just give me a second. I just need to get to my emails. Also, we'll be going for an hour roughly. I usually dedicate an hour to these calls. Let me look at my emails and let me look at the first question that came in this week, which is a question from Tonya. And Tonya says, hang on, this actually ties in with another email that she had sent prior. I do apologize. No, it's not. Hang on. I am sorry. My mother last year was in ICU when I had to do what I had to do. I had to get on the portal. I had to look up all the medicines they were putting her on. I had to go in and take notes every day. And one thing my mom had, she had to be an organ donor on her driver's license. Another thing is she went in with a hernia. They turned around and tried to blame it on her COPD. And I knew that was a lie because she could walk circles around me. And I don't have any breathing problems. So that's when I go on the portal because I felt something wasn't right. And hang on. I am not sure, Tonya, what you mean by that. It sounds to me like you might have your mum ended up being an organ donor. That's what it sounds like to me. And you think there might have been some foul play, but there's not enough information in your email for me to elaborate on that. Right? So I can't really answer your question because you're not giving me enough information, I'm afraid. I do apologize. So let's move on to the next question from Gabriella, who says, "Hi Patrick, I need to ask you a question. My mom is in ICU. She's 67 years of age. She got intubated. She got intubated about a month ago, and 10 days later, they put in a tracheostomy. Now she's back in the ICU due to low hemoglobin and low platelets. Blood pressure has been dropping. The nurses, put 3 medications, and the blood pressure started getting better, 96/53, but her O2 started dropping to 60 to 65%. The ventilator settings is AC, assist control, PRVC. The FiO2 is at 100%, respiratory rate at 16, no PEEP, volume is 475, inspiration is 0.75. Please see the picture attached, but her oxygen saturation reading is very low. Is there any setting that could be adjusted? I'm concerned the problem is lung expansion. Any information will be greatly appreciated. Now I'm just bringing up your picture with the ventilator settings so that I can actually see what the ventilator settings exactly are. And no PEEP, that's very unusual that there's no PEEP. So the only time I've seen people having no PEEP if they have head or brain injuries. Now you don't say anything about head or brain injuries. Your mom's situation might be improving if they can put on a PEEP. She's on 100% of oxygen. If her oxygen levels in the blood are 60 to 65%, she's at risk of sustaining an anoxic brain injury or a hypoxic brain injury, right? So something needs to happen here very quickly to improve your mom's situation, because she won't be able to sustain oxygen levels of 60 to 65%, because she will end up with a hypoxic brain injury. Now, again, this is a typical email where I'd say the biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care, because you are giving me very incomplete information. You know, you're saying your mom got intubated a month ago. 10 days later, she had a tracheostomy. Now she's back in ICU due to low hemoglobin and low platelets. You know, have they given her a blood transfusion? You know, have they given her a platelet infusion? You're saying the blood pressure has been dropping. The nurses put in 3 medications and the blood pressure started getting better. But her oxygen started dropping to 60, 65%. You know, but why is she in ICU in the first place? Why does she have no PEEP? You know, I argue there's only 1 in 1,000 patients. There's 1 in 1,000 ventilated patients that doesn't have a PEEP. You know, that's very, very unusual. Once again, the only time I have seen that patients don't have a PEEP is if they have a traumatic brain injury, right? So here's another thing, when you contact me or when you contact us, give us as much information as possible. I understand, you know, you don't know what you don't know, and it's clearly becoming evident, you know, in your emails or in the phone calls that I'm having, and that's what we're here to help for. This is no judgment. This is just an observation, right? But it's a critical observation. You know, you are giving me 50% of the information here that I need to know, Gabriella, in order to answer your question. You know, why is your mom in ICU? Why is she having a low hemoglobin? Why is she having low platelets? You know, those are very important questions. Now, let's move on to the next question from Raymond, who says, my dad has seizures with hypoxic brain injury post cardiac arrest, and he's in ICU now. I'm waiting for him to become conscious soon. What's the outlook here? Okay, so if your dad had a cardiac arrest in ICU, the first question is, how long was the quote-unquote downtime, i.e. how long did he need resuscitation for? You know, how effective was it? Was the cardiac arrest in hospital? Was it outside of hospital? Right? Do they think he has hypoxic brain injury? Is that confirmed in a CT scan of the brain, in an MRI scan of the brain, or is that just what they're suspecting? Right? Was he in cooling therapy after the cardiac arrest? Okay. For him to become conscious, you might have to wait for quite some time. Case in point, we are working with a client at the moment who has their mother in ICU for about a couple of weeks after cardiac arrest. And the ICU was also saying, oh, she must have a hypoxic brain injury, but they never had any evidence for it. They were even going as far, she has brain stem damage, but they've never done an MRI scan, never done a CT scan of the brain. They said, oh, she has brain stem damage because the neurologist did a physical exam. You know, you have to question everything when you have a loved one in intensive care. You know, it's unbelievable what some intensive care teams can get away with. You know, when we talk to families, and as soon as we start asking all the right questions, their narrative often changes, and it changes very quickly, because families realize that when we ask questions, that intensive care teams can get very defensive, and all of a sudden they're giving out information the families didn't even know existed. Okay, so it's critically important that you have an advocate by your side when you have a loved one in intensive care. Critically important. So coming back to your question, Raymond, how long will it take for your dad to regain consciousness? It could take days. It could take weeks. It could take months. I don't know. Would be important to see an MRI scan of the brain. Would be important to see a CT scan of the brain. Have they done an EEG? Also, if he's having seizures, is he still sedated? Is he on opiates? Is he on benzodiazepines? Is he having an EEG? Right, talk to the neurologist, or let me talk to the neurologist. You know, those are the things that we can help you with very, very fast. But, you know, a lot of patients do come out of cardiac arrest and survive. Now, the question is, what's their quality of life going to look like down the line? That's really the question here, whether you want to live with that or not. You know, I don't have the answer to that. You have to discuss this with your family, what is acceptable for you and your family in a situation like that. Okay. So I hope that helps, Raymond, to answer that question. Now, another question that has come in from Tanya asks, my mom has had life support removed, but my mom is still alive, but ICU is awaiting end of life. Right. Okay. That must be a terrible situation to be in, Tanya. The question is, why have they removed life support? Right. Why did they remove life support if your mom is still alive? Right. Is there outlook for her to improve? Should she go back on life support? Why did you agree to have life support removed? You know, maybe you're having second thoughts now, which is why it is so important that you get a second opinion, right? It sounds to me like you already have second thoughts now. You're already potentially distressed because you're wondering whether there's a return from this, right? You know, as long as your mom is alive, it's never too late, but you should have never agreed to having life support removed in the first place. You know, never, ever. And now the question here is, Tanya, ICU is awaiting end of life. Are they giving her morphine and midazolam to hasten death? You know, is she getting anything to manage pain? You know, are they potentially hastening death here? I talked about euthanasia and ICU before, and I'm not suggesting that this is euthanasia, but you have to ask the question. You have to ask the question, is it the right thing to do? And how, you know, how is your mom going to die? Can you live with that? Can you accept that? Does there need to be another way how your mom dies? You know, did you want to have it done at home? Have a look at intensivecareathome.com. One thing that I found over and over and over and over again is families don't ask questions early enough. You know, it sounds to me like Tanya sends this question when it's too late. You know, when it's too late. Don't ask questions when it's too late. Ask them when it's timely. You can never ask questions early enough when you have a loved one in intensive care. Okay, here is another question from Oscar. Oscar says, my dad won't open his eyes but is awake in LTAC with a tracheostomy and stomach cancer. Hasn't spread and he has a blood clot in his lungs. They want to put him in hospice. My family doesn't want to. Well, that's fair enough, Oscar. Well, I'm very concerned that he's in LTAC with a trach. That in and of itself makes me concerned. With trach and stomach cancer who hasn't spread and blood clots in his lungs. That's also concerning me that there are blood clots in the lungs. Does that mean he's got a PE, pulmonary embolus? Right? And if your family doesn't want him to go to hospice, then it's a clear no. No one can force you to go into hospice. Nobody. Right? Also, the question is, does your dad have an advanced care plan? Because if your dad has an advanced care plan that documents he doesn't want to go to hospice, he wants everything to be done, then he probably should be going back to ICU. I'm very concerned that a blood clot in the lungs will not be treated by the LTAC. I think that's very fair to say that the LTAC will not treat a PE, a pulmonary embolus, unless they have an ICU attached to it. Right? So, bottom line is, if you don't want to move him to hospice, then you don't, and you shouldn't. No one can force you. You are in control, assuming you are the power of attorney, right? Or whoever is in charge of your dad's medical care, they are the people that make the decision, not the hospital, not the LTAC. You know, they just want him out, whether that's by moving him potentially to a skilled nursing facility or by potentially letting him go and die. You know, very distressing, very distressing. Okay. To avoid situations like that in the first place, for anybody watching this on replay or here still, never go to LTAC. Never agree to go into LTAC and never agree to end of life. Never, ever. Right? If you've only watched this show for that minute and you got that takeaway, then I've done my job. Never, ever agree to end of life. Never, ever agree to LTAC. Without doing all your research anyway. Okay, so let's get on to the next question from Betty. Betty says, my 51-year-old son was intubated due to respiratory failure and heart failure. At one stage, we were told he might not make it. 3 weeks later, he recovered and transferred to a rehabilitation hospital. Unexpectedly, ICU rang my son to seek his permission to release his brain data for international practice. My son came out totally different. I would appreciate your feedback, Patrik. Well, it sounds like to me like there has been some medical research going on. It sounds to me like you should have never, I would never agree to medical research, never. Right? There's too many competing interests from my experience. My son came out of it totally different. Yeah, I don't know what happened there, but it sounds to me like your son might have been part of some study, and your son might have been part of some clinical trial. And I don't know whether you are the power of attorney for your son. You haven't shared that. Someone must have given consent to it. Well, I would revoke consent to it as soon as possible, to not have him participate in any other study. Okay, that's dangerous. Here's another question or comment from Nancy. Nancy says, I wished I knew more at the time. My grandson died on July the 20th at the age of 13. I saw his eyes slightly open. It was so upsetting to see this happen. His mother had him on morphine, stating she didn't want him to suffer. Sure, the morphine makes people stop suffering, but it also kills people. Don't get sort of sucked in by the negativity of intensive care teams and saying, well, the only way forward here is palliative care, end of life care, giving morphine and midazolam. Don't get sucked into that, right? So, and this actually, those comments from Betty and from Nancy actually came after a quick tip that I made online where the title is, the ICU team is only telling you half of the story. Isn't that interesting? That those comments came after I published that video. And they are telling you only half the story unless you are asking all the right questions. Okay, let's move on to the next question. From Z. My dad had the septic shock. He got pneumonia, from which he recovered almost 70%, but his creatinine levels started increasing in the range of 2 to 2.5, and also his urine test showing red cell count of 88 to 90 and white cell count of 45 to 47. He also got collection in sputum due to sepsis. What should I do? His saturation is good. He doesn't need oxygen. He got pneumonia from almost 70%, but his creatinine levels started increasing, and also his urine test showed red blood cell count and white cell count. He also got collection in sputum due to his sepsis. What should I do? His saturation is good. He doesn't need oxygen. So Z, it's a bit, again, you're giving me incomplete information here, but I'll try to answer it with the information that you've given me. Well, what should you do if he's got a septic shock from pneumonia? Well, first off, they should be treating the pneumonia with antibiotics, assuming it's a bacterial infection. If it's a viral infection, they need to treat it with antivirals. If it's a fungal infection, they need to treat it with antifungal medication. Okay, that's first thing. Now, if he's in sepsis, you got to look for other issues such as, is he getting steroids? Is he going into kidney failure? What's his lactates like? What is his white cell count like, which you've already highlighted to me? What is his temperature like, right? Does he need hemodynamic monitoring such as cardiac output, cardiac index, because he's in septic shock, right? Those are the questions that you should be asking at the moment. And if he doesn't need oxygen, that also might mean that his pneumonia is clearing up. Okay, what are other ventilator settings? How much FiO2 is he on, right? How much FiO2 is he on? What's his PEEP like? What are his arterial blood gases like? Is he on inotropes? Is he on vasopressors, right? Septic shock, many people in ICU are dying when they are diagnosed with septic shock. There's a higher mortality for septic shock compared to other disease processes in ICU. I don't have the exact stats, but it does have a higher mortality rate. So, if his oxygen level, his red cell count is 88 to 90, he doesn't need a blood transfusion just as yet, and go from there. At the moment, what you need to do, Z, is to wait. Let them work their treatment course and reassess it. This can take a few days. There won't be a quick fix here. It'll take a few days. That's for sure. Okay, let's move on to the next question from Ismail, who says, "Hi Patrick, they want us to give up on my dad. When do I know they haven't? When I know they haven't given every possible treatment?" Well, I'm glad you know that they haven't given him every possible treatment. So what you need to do is you need to challenge them, right? And I can help you with that. And that's part of our consulting, to give you a second opinion, to talk to doctors and nurses directly, this is pretty much what happened this week. We are working with 2 clients at the moment where the ICU wants to give up, and we are asking the right questions, and we challenge the narrative, and we make suggestions, and with good outcomes. One of the ladies that we work with, or the man that we work with, his mom is in ICU, and the ICU team said, well, she will never wake up. She's got brainstem damage, even though they had absolutely no evidence to even say that. And now a few days later, after she had a tracheostomy, she's now waking up. Their narrative is collapsing like a house of cards. You got to question everything, especially when the ICU team is trying to push you towards end of life. You have to question everything. So if they haven't given you that every possible treatment, get me on a call with them, or get on a call with me. First, we'll work out treatment options, and then we can go back to them and advocate for it. It's as simple as that. It's no more complicated than that, right? So, next question from Vincent. What is your biggest frustration right now? Lack of a treatment plan. There are so many alternative therapies, and my family member is not getting anything other than supportive care. Well, that's actually very similar to the previous question. Very similar. If she's getting supportive care, they're already winding things down. The question here is, does your mom have an advanced care plan, right? Have you got anything documented what she wants? Because if she wants everything done, she wants everything done, and that's a right, not a privilege, right? If she's not getting, anything other than supportive care, it's not good enough. It is not good enough. And you can force them, you can force them to give your mom treatment. It's up to you. Assuming you are the power of attorney, it is up to you, not up to them. Okay, keep that in mind first and foremost. Okay, I do believe I'm going to wrap this up today. Thank you so much for watching. Thank you for your support. Thank you for coming onto the show. Also, thank you for those watching on replay. I do these YouTube lives every Saturday at 6:30 p.m. Eastern Standard Time, which is 3:30 p.m. Pacific Time, 4:30 p.m. on a Saturday Mountain Time, and 5:30 p.m. on a Saturday Central Time. I usually do them at 10:30 a.m. Sydney, Melbourne time on a Sunday morning, 9:30 a.m. Brisbane time, right? I do those YouTube lives every week. Next week, I'm going to talk about Indy Gregory, in memory of her. You can type into Google Indy Gregory to prepare you for what's going to come. Again, like I said before, the UK courts have done it again. They have allowed the NHS to kill innocent children in ICU instead of getting them to another country where they could continue treatment, right? But I will talk more about that next week on the YouTube live about Indy Gregory. Now, if you have a loved one in intensive care and you need help, go to intensivecarehotline.com, call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com. Also, we have a membership for families of critically ill patients in intensive care at intensivecarehotline.com. By you clicking on the membership link, you can get access there, or you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we also answer all questions intensive care and intensive care at home related. I also offer one-on-one consulting and advocacy over the phone via Skype, Zoom, WhatsApp, whichever medium works best for you. And I talk to doctors and nurses directly. I talk to you and your families directly, and I ask all the questions that you haven't even considered asking, but you must ask in order to make informed decisions, have peace of mind, control, power, and influence. I also offer one-on-one consulting and advocacy, again, over phone, Skype, Zoom, WhatsApp, whichever medium works best for you. I talk to doctors and nurses directly, right? Again, I ask all the questions you haven't even considered asking. I also represent you in family meetings with intensive care teams, making sure you're not getting walked all over, making sure you have a strategy when going in there, making sure that going there is the first thing to do in the right thing to do in the first place. So I'm going to help you with all of that. If you have family meetings with intensive care, don't go there without a written agenda. Don't go there without having clinical representation from myself there. We also offer medical record reviews in real time. If you need a second opinion in real time, we do that as well, by us looking at medical records and giving you a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. Now, if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care and intensive care at home. Click the like button, click the notification bell, share the video with your friends and families, comment below what you want to see next and what questions and insights you have. Thanks for watching. This is Patrik Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.